You would agree with me that there are different urine colors, and in every single day we go to ease ourselves, we tend to notice a little or a slight variation in our urine color. Welcome to my YouTube channel. I am Nurse Patience, and today in this video, I'll be telling you about the different urine colors that you might be likely to see and what this could simply mean. Urine color varies depending on what you eat, the medication you are on, or how much water you drink. And the normal urine color we all know is from pale yellow to deep gold, which can also mean amber. The deep gold can be replaced with amber, but there are different urine colors that could either be a red flag, or it could be that there's something you are not doing right, or there's something you are on that if you would suspend, your urine color will return back to normal. So here in this video, the first color we'll be looking at is the deep yellow urine. The deep yellow urine simply means such an individual is dehydrated. You'd agree with me on certain days that you worked and worked and worked with little to no break time to go drink water. You notice when you go, you don't tend to make urine on such a particular day often. And when you go to make urine, your urine will be concentrated and it will be deeply colored, deeply what yellow in color. And this is due to dehydration because you did not have up to the amount of the daily requirement for what you need for your water intake for that particular day. The second color here is the red or blood in urine. By red, we all know that human blood tends to be red in color, or reddish brown, as some school of thought will put it. But when you start seeing red, a red colored urine or blood in your urine, it could be indicative of an STI or a kidney disease, or the food you are taking. Research has shown that food like blackberries tend to affect your urine color negatively. And even for this part of the world where we are in Nigeria, there are, I think for that blackberry, it is not a very known common fruit, and it might be difficult for somebody to actually have a red urine coming from blackberry fruits that that person have taken. So it could definitely, the two options here would either be infection, which is the STI, sexually transmitted infection, or kidney disease. The next color here is the orange colored urine. Certain medications, when you notice, you know what orange color would look like. If you're having urine or you passed urine and you notice the color is yellow, it is normal. But when it is orange, it becomes a red flag, and it is either something you are not actually doing right there. So it could be as a result of the medication you're on. One of the medication here is the anti-TB medication, which is the rifampicin. Rifampicin is one drug that is used in the management of tuberculosis. And if you have tuberculosis and you are on rifampicin, there is a high possibility that you would be having a slight deviation from normal in your urine color. So it is still okay, provided you continue taking that particular drug. Your urine might continue in that same color, but once you stop it, 2 to 3 days, your system will normalize and you start producing the yellow to the deep amber urine, deep gold urine, which is also amber, which is the normal urine color. Then also another kind of drug class that would make a urine to be orange in color is laxative. It can also affect your urine negatively by changing the original color. Then a clear urine, you notice there are times when it is cold and you take a lot of water, you notice when you go to urinate, your urine tends to be white or pale in color. When you see a pale urine, it is indicative that you are drinking more than your daily required amount of water. And we all know that drinking water is very good, but when you exceed the daily required allowance for your water intake, that means you are robbing your electrolytes. Those electrolytes, they are meant to help keep your body homeostasis going and functioning the way it should be. But when you take lots of water, they tend to affect and dilute these electrolytes, making some of them to come out now as urine. So if you're the type that drink more than the daily required allowance of water, then you need to cut back on your water intake to ensure that your electrolytes are all doing well as much as you take your water. So a clear urine would can be indicative of certain medical condition. For example, viral hepatitis and liver cirrhosis. If you're having clear urine and it is not due to taking of too much water, more than the recommended daily allowance, then it could be indicative that you are either having viral hepatitis or liver cirrhosis. So if you are not having, if you know that your clear color urine is not as a result of taking of too much water, then it could be that you are having either of these two conditions that have been mentioned. You need to go see your doctor and run a test to be able to know if it is what you are having, or you don't need to worry yourself about it. Then the next color of urine here, I already spoke about it earlier, is the yellowish or the amber urine, which is yellowish to deep gold. So amber can be replaced with the deep gold color which we have here. I didn't state it from the beginning of this video. The pigment that is responsible for the coloring, that's the yellowish coloring of the urine, is urochrome. I would spell it for you: Urochrome. That is the spelling of urochrome. Urochrome is that pigment that is responsible for the coloration of our urine, and if it gets overly diluted, it would give us a pale urine. And if this urochrome is being affected with the drugs we take, it tends to alter the color in which this pigment gives. So the next color we'll be looking at here is the cloudy urine. In cloudy urine, some people tend to notice that there's a little bit of pus. Let's say if there's you have a clear water and you drop a little bit of pus, that's puration. It you notice it tend to change the color of that water or that fluid in which you dropped. Same thing in urine. If there's a pus collection somewhere around the bladder or the urinary tract, and such an individual passes urine, there's a high possibility that that urine will be cloudy. And for a cloudy urine, it could just mean two things. It could either be UTI, which is what, urinary tract infection, or it could be a sign of preeclampsia in pregnancy for individuals that are pregnant. If you are not pregnant and you are having a cloudy urine, it could be that you are having UTI. So all you need to do is you tend to monitor yourself and know those signs. If you are not having any visible sign, maybe you have to go for culture microscopy. If you are not having any visible sign, you would need to go to the lab to go get your samples given, and also they would run a test on those samples to be sure and ascertain that you don't have any form of microbial infection that would cause you UTI. But if you are pregnant and your urine is cloudy, it could be indicative of preeclampsia in pregnancy. And we all know, if you've not watched my video on hypertension in pregnancy, you can go watch it on the same channel. There you know fully where I discussed about preeclampsia, and it is one danger sign of pregnancy that will not allow the woman to carry her pregnancy to term. And it is usually a high risk pregnancy because such an individual cannot deliver by themselves due to this offshoot in their blood pressure. So if you want to know more about preeclampsia, you can kindly search for hypertension in pregnancy on the same video and you watch it. Most cases of abnormal urine color is simply as a result of dehydration. You would agree with me that anytime that you see a deviation in your urine color, it is usually due to dehydration. That is, you are not taking enough water as you should. But sometimes what we eat or the drugs we are taking might have a side or a negative effect on our urine color. Also, I need to tell you that this video was not just made for anybody. It was made for woman, man, student, nursing student, medical student, normal people who need to know about their urine color and what it says. Thank you.